Appreciate everybody taking their Tuesday night to hang out with us. We're going to go through pediatric dentistry and using digital scanners. I'll get started. As Jordan mentioned, save your questions for the end. We'll be able to answer. You'll also have ability to reach out to us afterwards and get with us if you have any more insight or question needs after you either get started with everything or still debating whether or not to pull the trigger on a scanner. So just a little info about me. I'm born and raised in Florida, right outside of Tampa. Went to Florida State for undergrad, Nova for dental school, and then my residency here in Florida at UF Naples. Currently own a practice in Apollo Beach, Florida, which is a little south of Tampa proper. And we did bring a scanner into our office around 2023, and it's been pretty awesome, transformative for just the flow. We'll talk a lot about the ins and outs of it, but the objectives for tonight: one, we just want to understand the benefits of using digital scanning in your office, how it compares to traditional techniques, and how you can benefit workflow-wise, production-wise, and just patient satisfaction-wise. We'll go into some clinical applications on use. There's a wide array of ways to utilize this in your office, whether it be just bread and butter spacers to aligners to more indirect restorations, 3D printing. You can do a lot of cool stuff with it as you kind of get using it. We will go over some scanning techniques. The great thing about the Allied Star is it's very easy to learn how to scan, and we'll kind of go with some examples of how to train your team and just getting used to utilizing it. We'll go through some of the workflow that we utilize in our office and you guys could utilize in yours. Makes your day a lot smoother on the scheduling front, a lot smoother on the assistant and scripting to the lab front, and then translates to a smooth back and forth from the lab. And then obviously as business owners, if you're looking into buying one of these, we're going to talk about financial advantages of having a scanner versus more traditional tray and impression material. So we'll dive in and I'll try to get you guys all the info you need. And like I said, if you have questions at the end, feel free. We are open books.
Hey, real quick, Casey.
Yeah.
On your screen share, it has like the pictures of Isabella and you and I on the right.
Oh,
And say, I don't know how you. Oh wait, now it's all of us.
now it's all of us.
There you go. Cool.
All right. I was like, you didn't want to look at yourself the whole time?
It was a little creepy.
It's all good. All right, guys, we'll get rolling. So why am I here? New Smile asked me to help them with this because I have owned since June of 2023. When they came to me, or I saw them at a conference with this as they were launching, I was very interested. I've been looking for a scanner that was made for pediatrics. I hated taking physical impressions on kids. Typically, full arch impressions didn't go super well unless you had a very chill patient. And I dreaded those appointments more than them for sure. And it just always kind of put a damper in the day. For me, I like to make sure I'm having fun during the day, my team is having a smooth schedule, and my patients and parents are real happy during it. We were able to integrate it into the office really seamlessly. It was a smooth transition. It's really a plug and play type technology, especially when you include the laptop with the purchase. And we'll kind of give you some examples. Jordan will do a roll through video of how to set it up and use it. And you can, from box open to plugging in and setting up within 5 minutes, you're scanning and do what you need to do. In my office, we really are committed to using the latest tech. I never want to be the first one, but I don't want to be the last. I do like to utilize the technology we have in 2025 to make my life easier and my patients' experience better. And at the end of the day, this has been able to do all of these things. So benefits for me, it was really, I just hated taking full arch impressions. I hated the lab work that was associated with it. The sometimes disconnect with your impression to that pour of the stone to the appliance or space maintainer or whatever you were getting back. It's not always perfect. Most of our cementations was a little bit of wire bending, a little bit of adjusting. When we're getting into this, it made it much smoother. The dental assistant learning was very easy. When you start introducing tech to your team members, you're going to have veteran dental assistants and RDHs who have been doing this for 20 years. Some of them are very good at being tech savvy and kind of learning this stuff. Some are not. Your youngers are usually a little quicker, but even my more seasoned assistants learn this very quickly. They learn on each other. We took time to practice on each other, and we'll kind of go through some of those tips. The other aspect that I really didn't think about, but after utilizing it and kind of educating myself more on it, is you don't have alginate inventory and you don't have actual stone models in your office. I have not bought trays and or alginate or PBS or anything since I have switched. I still keep a few in the office just for those rainy days if I need to get a direct impression. But at the end of the day, we have not used it, and it's just kind of sitting, getting dusty in a closet. And the biggest thing is happy patients, impress parents. Parents want to know that their kids' doctors are doing the most up-to-date kind of tech. They want to make sure they're doing what's going to be the easiest for them. And this makes getting those impressions on your wiggly, tough kids, limited openings, and or patients with special needs who don't like a lot of stimuli in the mouth a lot easier. The efficiency is my biggest thing. I like to be able to move room to room. I run a slower schedule, but still, as a pediatric dentist, we are busy. I like to talk a lot and educate a lot to our patients. This allows me to kind of get in and out of the rooms. The accuracy makes it an easy fit every time. I do not have to do adjustments on the appliances or space maintainers that come back. 99.9% of the time, they're going to fit great. The only time they don't fit awesome is if a kid waits 6 months to come get their spacer. And we've all been in that, where we might have to reimpress and send out again. Faster chair time for me, it's just means we can do more per day. Instead of blocking a 30-minute block for an impression, we can block a 15-minute block, and I can throw a follow-up or a quick SDF appointment or seal appointment in that meantime and keep that room more efficient, more productive. The turnaround from the lab is also a little more efficient because you're not mailing to them, you're just sending digitally to them. There's only a one-way return, so you have less shipping fees and a faster turnaround time, which is wonderful. It just makes getting those patients back in for their cementation appointment a lot quicker. The integration with the other tech was big for me too. I like that it's open architecture. I did not want to be limited to a scanner that I can only use with one company or one practice management software or one anything. I like to have the ability to work with any piece of technology, have third-party integration available, and this makes that very easy and flexible. And then my favorite thing that I didn't really think about purchasing this was more of the indirect banding. I used to take my rings and put them on the teeth and bend them in, and that's how I was taught in residency. I wanted a really secure fit around the crown of the tooth, make sure it wasn't going to move. With this, I do not have to worry about it anymore. So I don't have to seat bands on a tough kid with inflamed gums and kind of push in there or place seps or anything like that. I can just take my scan, send it to the lab, and everything's going to fit really nice. And they do have some very cool options with NeoLab, one of their partners, on not even getting in between the teeth and just doing like a cuspal coverage with their 3D printed aluminum appliances that we'll talk about a little bit as well. So why did I choose the Allied Star out of everything on the market? As I mentioned, I was looking around. I was kind of price shopping. I was looking at dental marketplaces and seeing who might have a scanner for sale. The biggest thing in my office, I don't like a lot of cords. I don't have overhead lights. I like to keep everything clean. We have a lot of kids running around the office, not just our patients, but our patients' siblings. I'm big on like, hey, let's have a party in the room, and I'll let families come back with their crew. Having less wireage and the ability to kind of just have this on a cart with just a laptop and the scanner and not having cords between, really nice. And the heads of it are made for pediatrics. They do have traditional size tips. So if you want to scan an older adolescent, teen, or even adult patient, you can with no issues. But for your smaller patients with smaller, max openings, they have the smaller head, and you can get in there even on a really small child and have the ability to do a good job. The other aspect was talking with my IT guy. Well, what kind of laptop do you need? What kind of tech needs to be in it? What do they need to run this process? So trying to like troubleshoot that, buy a scanner, and then find a laptop that was conducive to the tech needed. This made it simple. I didn't have to think about it. Didn't have to call my IT guy, and it made it seamless. Came with a 3-year warranty as well. So like I knew, hey, I had 3 years with this thing. I've been using it for almost those 3 years, no major issues, and been using it weekly, daily ever since. The interface makes it simple for your assistants. This is one of the biggest things for me. I like to put a system in place, let my assistants flow with it. I don't want them to have hiccups in the learning. If there's hiccups in the learning, then I need to rearrange things. this whole process from the scan to the lab script to getting it out to the lab makes it very, very simple, much less chair time for me. I go in, introduce, talk about what we're going to do. My assistant takes the impression. I review. They do the script. At the end of the day, I read it once, click send, as long as there's nothing else to change. And the scripts that NeoLab puts in place makes it very simple for them. I did talk about the tips. The no recurring cost was huge for me. Me and Jordan were talking earlier about other products on the market, and I didn't want something where if I bought it, no matter whether I'm using it a lot that week or month or a little, I'm paying for it monthly. To me, that's very bad business in a sense. If it's a good product, you're going to pay for the product and you're going to be able to use it and benefit from it without having to have a monthly recurring charge, which helps with overhead. And again, we talked about the open architecture. I do utilize NeoLab. I used a traditional dental lab for all my space maintainers, appliances, mouth guards previous to this. I can still use that company because it's an STL file that you get from the scanner itself. But working with NeoLab just makes my life so much easier that I really transitioned almost all my lab work over to them, unless I'm doing some fancy cosmetic stuff. This is a great chart. I wish I would have had this when I was doing my comparisons instead of my little notebook, kind of bare bones, figuring out these costs and advantages and disadvantages for myself. You see the AS260 and the AS200E. They are very similar, just a little different. Your 200E is going to be your wireless version, which is the one on the right of your screen. And then your 260 is your wired. Essentially, they're the same scanner. They're going to do the same thing. You have a little weight difference. The weight of the AS200E is not significant in your hand. You don't feel like, you're belabored doing it. Even my little petite assistants have no issues kind of wielding this thing and getting the right position and angle in the mouth. So that was a moot point for me. And it is significantly lighter than a lot of others on the market. The no fees, again, huge for me. I did not want that to happen. And everything else coming with it was huge. So the price point for me was ideal. I wanted something I knew it was going to cost money. I knew it was going to be investment in my office. I wanted to make sure I had a solid ROI with that without breaking the bank. Because as a business owner, I always want to make sure I'm not overdoing it with something I may or may not use a lot. Turns out I use this thing all the time. So this is just a little kind of breakdown. Your traditional appliance workflow, which we have all done through residency, private practice, associate practice. You're going to take an Algin impression. That can be super quick. It can be super slow. It depends on the KIG, the gag, how the impression went after you pull it, or there are pulls in it. Did you get the anatomy you need? With this, as you're scanning, you're visualizing the anatomy. If you're not capturing the anatomy, the screen will tell you where you're not capturing it. And it's as simple as just scanning back over an area that you have already scanned, and it will pick it right back up and keep it going. The scans themselves, they get really quick. I scan, I'd say maybe 5% of the time. My assistants scan 95% of the time. The fact that they scan more than me, they are probably 2 times as fast as I am just because they do it more. And even kids who are very hesitant, they like the technology of seeing their teeth on the screen and it translating from the little magic wand. So it is really good for behavior management too. And a lot of kids look at it like a video game. They're very interested in the appointment, and it can help the entire, hey, we have to do this kind of procedure that might be a little tough, but we get to do this cool stuff along the way, which is nice. The no pouring of models is big. If you have a lab area, especially if you're pouring stone and trimming stone in your office, you have a mess. Typically, you have traps you have to worry about and sinks getting clogged. That's not happening in our office anymore. Don't have to worry about any actual lab work done. There's no trimming and shipping, obviously, and you're uploading files. That's really what you're doing when you're sending your script. It is all harbored in their website, and it will get sent directly to the lab that you want to. That takes no time at all. With NeoLab, we have templates set up, so 90% of our cases, it is going to be a bread and butter appliance or a space maintainer that we've utilized before, and they can click. Within 30 seconds, they have the script all ready to roll, and I just review at the end of the day with a click of the button after I read it over. Talked a little bit about the 2-way shipping cost versus the 1-way. If you are not fitting your own bands and mailing them into the lab, and you can do that if it's still like, hey, this is my baby, I want to do it. You're just going to be shipping back one way. So typically you're going to be able to get that back within a 2-week period, so you can have timely turnover and make sure you get your spacers in or appliances in as needed. And the impressions themselves, like just having digital impressions versus the actual traditional workflow of alginate impressions and trays and model pours, you're going to pay for the scanner itself just within 2 years. And that's just like your basic ROI doing bread and butter pediatric dentistry that we always do. So we're going to talk a little bit just about walk through setting up the scanner, the laptop. The laptop that they offer comes preloaded with all of the software you need, the capability system-wise to run everything you need. We'll talk about starting the scans, troubleshooting during. The easiest way we did it, like I opened the box, I plugged it in, I started playing with it. Like that's just me. I like to kind of just see how it goes and then ask for questions later. Jordan gets that from me sometimes. We'll be like, all right, I open this, but how do I use it? That was more my sew-in side of things. But we had them practice on typodonts. That's really in your face and easy. They can kind of visualize the screen and their hand at the same time. And then we had them do it on each other. That helps a ton. They get comfortable with kind of the positioning, adjusting themselves, adjusting the chair, making sure they're capturing the anatomy that they need, and then learning that reorientation when you lose a spot, because you're going to lose spots here and there. It makes it super, super seamless. I remember in dental school working with, I don't even remember what scanner. It was very difficult if you lost the spot to kind of get back to where you were. This makes it just kind of roll back to any tooth you were on. The box will turn green and you can kind of get things rolling. So we'll roll through a quick video. I'll start this for Jordan.
Action. So today we're going to be going over how to set up your scanner and going through a full scan. So first thing you want to do is take it out of the box here and we're doing the wired scanner today, this AS260. You want to be sure to grab your power cord. You're going to get this all plugged in. So you're going to take your USB, plug it into your laptop here.
And so again, I talk in the video, so I'll just kind of let that play. I can hear it, so I hope you guys can too as well.
We'll get our scanner set up. Now you're going to want to take off your protective cap and you want to use one of your scanner tips. This one is Aaron's. So go ahead and pop this on. Take your little holder. Set it aside for right now. Now, what you want to do is you're going to want to open up your software. We're going to use AS Connect right here. So we're going to open that up. Now that we get that open to go into our cases. In here, we're going to want to select new case. So we'll be practicing on Aaron. And as soon as you make your case name, it's going to auto-populate generate. So up here on the top right, we don't need to worry about anything else at the moment. We're going to hit scan at the top right. Once we hit that, this is going to open up what's called Scan Pro. This is our scanning software. We take our scanner off the charging base here. We can see light is always on. That does not mean it's scanning. However, when I press this button at the top, it begins to scan. Press it again to stop it. No box enters. So today we're going to be scanning Aaron. Aaron, we're going to start with the lower. So all we got to do here, click the little M button. We can see the top of the laptop right up there on our lower icon. However, if you don't scan the proper upper or lower, you can always flip it in the software as well. So you don't have to worry too much about that. So we're going to go ahead and scan. So what you want to do is we want to start in the posterior on the occlusal surface. So we're going to start back here. Go back to the occlusal surface. We're going to work our way all the way around. Once we get to full posterior, we're going to start to work our way buckwheat. And then we're going to go where we do. Let's stop our scan. And we're going to see what information we have here. So now at this point, these specks here, these green specks are telling me where we need to go back and hit. So we can see we have some interproximal spaces, mainly on the lingual side, and then here on the facial of the anterior, of the lower incisor. So all we're going to do, we're just going to go back in, we see our spots, and we're going to touch those. Why don't you open up for me, Aaron? So again, I remembered mainly on the lingual surface of the posterior. Make sure you hit all the interproximal spaces. And then we're going to come up here to the anterior. I'm going to make sure we're going to try and get properly of that facial side. So that should be pretty good. And what we can see here, we've filled in just about all the gaps there. We have a couple little smaller interproximal spaces, but we're perfectly good. So now we can see our 3D rendering here, really good scan. We don't need to cut anything out. Of course, if we were going to be doing sort of space maintain or anything else, we don't want to go touch up on those spaces again, just for the greens. But right now, just for records, we're good to go. So only difference would be, we're just going to do the lower today. If you wanted to, you would just click over into the upper, do the exact same thing on the upper, and then full bite, once you have the upper and the lower, just scan both sides for your full bite. However, we're just going to do the lower today. And again, the main point is you want to start in the occlusal surface in the posterior, work your way all the way around, work buccally, lingually, and then that should be your whole scan. So now we're going to click up here when we're done with our scan on the Refine tab. Telling us we have not captured the upper, it's fine. So once we hit Refine, what this is doing is this is turning the scan from a raw format down to an STL format. So it's really, really condensing that scan. It's kind of talking to itself. And now we can see, boom, it's refined. And now at this point, we're finished. What we can go ahead and do is we can click Finish up here at the top right. And then now we have our file. We are finished. We now have Aaron's lower jaw scan in here, and we can do with it as we please. And that is your whole start to finish, setting up your scanner, getting a scan, finishing your case as quickly as that.
That's basically all of it there. From like out of the box, plug it in, scan. We do also offer training onboarding. I know we're gonna get into that a little bit later. That's entirely free. Of course, you could be like Casey and you could just pull it out the box to just get to scanning and start practicing. So entirely up to you guys, but we do offer that as well. So if y'all want some sort of support, you're more than welcome to be able to schedule that as well with our support team, who's quite a bit more technical than myself even. So.
Yeah. And this is just the comparison between the two. This is a video of one of my assistants and one of our patients just doing a full arch scan. We have it sped up so it's a little quicker, but you'll see the upper, lower, and the buccal bite for that full kind of bite registration you might need for a full mouth appliance or a liner case. The main difference is obviously this one's not the wired version. You can see on the side of the laptop, the little kind of USB port, that's your little Bluetooth connector. And that's really what connects your device to the laptop. So that's really the biggest difference between the two. One cool feature that I didn't even know about for the first couple of years of using it that we ended up doing after I learned this, Jordan, was instead of that little kind of like tack, 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 and that's telling you you're capturing the kind of surfaces in the software, you can add a song to it. And we ended up going with like the Mario Kart, like you hit the star kind of song. So the kids love it even more because it's like a video game's going on in their mouth while we're doing it. Really helps with that kind of patient interaction and just keeping it really fun. This is, like I said, sped up. So you'll kind of get a view of your patient kind of sitting there. We're getting the upper arch first, kind of utilizing the scanner just to get the anatomy that we need. This was for an aligner case. So really just need kind of your full arch. And then not a full palate, but we usually will capture the palate just in case the lab might need a little accessory anatomy. She did the upper, kid loved it. Let's look at it. Okay, let's do the lower. And she flows through that really quickly. And then once you're done with the upper lower, getting your actual bite registration is just a right left buccal corridor scan. Once you get all that, the computer software will put it all together, and you're really ready to rock and roll. Again, the patients love it. They like to kind of see their teeth in the kind of the multi-dimensional state, and then getting those buckles is extremely simple. You're just kind of having them bite down and get it, and there you go. Really quickly, you have that all ready and good to go. So it's as simple as that. Obviously, there is some practice getting it going in your office with your assistants and yourself. As Jordan said, you guys can totally utilize the support. New Smile does have a ton of support. They're always willing to help out people with their products. So don't hesitate to reach out if you have a question. A lot of questions are answered on their webinars, which is on their website. But reach out direct. You can reach out to me, Jordan, the team, and they'll help you guys. This is another person who owns Allied Star. They wanted to kind of show how they were training their team. And this is what we did for our team. We put an assistant in the chair, had another assistant scan, learn the software.
It stops. You have to go back to an already scanned area to pick it back up.
Okay, got it.
And the little click stop, the box turns red. That's where you know you just got to go back to one of your already scanned areas, and you're going to be ready to keep moving. Now, once you have your scan, it's been compressed to the STL, and you got your kind of model ready to go. You're going to send it to your lab. I utilize NeoLab. This is kind of their create the case kind of portal, where we have this kind of set up in our office where we have predetermined templates for all the traditional appliances we use. Within these, you can modify them as you will, but the majority of your Nances are going to be Nances. You might change the color of the acrylic. Your lower linguals are traditionally going to be the same. Band and loop's the same. Mouth guard's the same. Once you get something that works in your hands, most of us are going to continue to do it. If I do have atypical anatomy, distal operculum I'm dealing with, or hey, like I've taken scans during an IV case where I have a wedge and a band like on the teeth because I'm letting like a glass ionomer set, and I want to just get that scan done because I don't want to risk airway involvement or having the kid under for too long. I'll leave it in the scan if it's not a part of my appliance area or a part of the anatomy that my lab needs to do it. And I just write a little note, hey, I know this is here. Just cut that off the 3D model when you print it. And they're very fluid with doing that, knowing we kind of work outside of the norm all the time. This is a little video just kind of walking you through how to get into creating a case. They're going to pick the Nance appliance template. This is a very common one in our office. One thing I do love about the NeoLab setup is once you get it plugged and chugged, even if it's a new assistant and they're unsure, maybe they've been walked through this once, you got a little systems protocol next to them, they can kind of just play with it and get to where they need to go. When they're going over the bonding options, there's little image kind of picture things on the side where if you hover over it, it will show you what that looks like. I think they hover over one of those. There you go. So there you can kind of see this is what my band would look like. The coolest thing that they do is a aluminum 3D printed, we call it an SLS band. It's really just a cuspal coverage. So it doesn't impede the gingiva. It's all super gingival. And I usually do them with an opening on the occlusal surface. It helps with cleansability and it helps with stimulation. So like if I have a kid that is very sensory and they've got gingivitis and, we're working on hygiene, I know I need to seat this appliance. I may do their dentistry asleep or sedated, but I know I have a cementation coming up. I'm going to elect for an easier cementation for that kiddo. I want to make sure I get it in. The appliance is going to do its thing if I don't have the ability to kind of have it made for the sedation itself. And the SLS coverage, I used to, when I first started looking at it, I'm like, this is not going to stick. There's no way that this is going to hold up. And I'll kind of show you guys some examples of what that looks like. And it's made my life a lot easier for the patients. Again, this is kind of just your prescription page. You have all your different categories, appliances, your band options, kind of what you want, and you can modify everything as needed. Your assistants will do all of this if you train them properly. And then at the end of the day, I just kind of click through open cases, make sure that this is correct, double check my note, make sure I'm, not doing anything outside the box, and then you're ready to rock. Same thing with lower lingual. You're going to get it on the 6s and kind of do what you need to do. Again, Nance. So this is great just to have for your team if you're utilizing any scanner, especially newer assistants or assistants that always want to double, triple check things, which I love. They want to do it right the first time. This shows them, hey, this is the appliance that Dr. Lynn prescribed. This is the scan that we need for that. It allows them to not question it or not get partial scan and you have to come back in and check and you're like, actually, you need to get that kid back in the chair because we need that palate or we need that buccal corridor a little more. The majority of them are very straightforward. In pediatrics, we don't do anything too crazy on the appliance front, but it does kind of help your assistants and it's just a quick check and go. These are those band options that I was alluding to. So the Dr. Fit is what I did the majority of my career. I'd say 2015 to 2023, I was fitting my own bands. I was taking my own alginate impressions and making sure that they were where I wanted them. As I mentioned, like that was how I trained. So I was very comfortable with it. And I always wanted to make sure my band at least stayed put and wouldn't slip off or it could get to where it needed to go. You can still do this. If this is your kind of comfort level of doing, you can go for that. If you just want to scan and not send those mailed in and have a little longer turnaround on your lab case, you can just say, I want a traditional band, but I want to do it indirectly. Scan your case. They will make little modifications so it can fit interproximally on those teeth. You don't have to send bands with that, so you can still get that quick turnaround. The 3D SLS is what I use for the majority of my cases, just because it is clean. I'm huge on hygiene around appliances, just like all of us are. We want to keep our patients, cavity free after we do a lot of dental work or have them in some guided ortho movements. So they will make this band where it does not go past the contact point. It sits super gingivally. You can modify this as much or as little as you want. If you want it to look more like a full crown on the cusp aspect and kind of get that retention even higher, you can. If you have a large distal operculum on the distal aspect of the tooth, you can't fit a band because bone levels or inflammation are too high. You can utilize this. This has been kind of my bread and butter for those earlier age kids where the 6s are the majority of the way in. I want to hold space right away and not wait for that full eruption where I could see the band on the distal aspect. And again, the cementation process with this, I did not think it would be that great, but they actually like micro etched the intaglio. So it's a lot of little micro kind of grooves. So the surface area is huge. And I use just Fujisim Ortho, like their blue, like your resin modified glass ionomer cement. It's not band lock. Band lock is stronger. But this, like I've been debonding a lot of these and getting them out of my patients that I started putting them on back in 2023. Like, time has come, tooth's erupted, let's get it off. And it is strong. I'm pushing harder than I ever did with just a Dr. Fit of, bread and butter Fujisim resin modified glass ionomer cement, which is great. It means the cement's doing its job. We still get it off, clean the cement like typical with the scaler, and you're good to go. This is just the comparison between your traditional versus that 3D. There's no set placement because you're not going interproximally. You're still going to cement the same way. You're still going to debond the same way. And like I said, I just use that Fuji OrthoSim just because I'm a glass ionomer guy, and it works really well. Keeps the gums clean. Kids can keep these appliances much cleaner than they would a traditional kind of full band that goes between the teeth. And I've got some clinical examples of some things. This is like just traditional band and loop that I use the scanner for. This was before New Smile had their chairside kit. I do utilize those a lot, especially same-day treatments and or sedations if I'm just doing a unilateral space maintainer. But the one thing I loved about it was the fit. Like it came back, within 2 weeks, there was not any movement of the teeth because we got it back in a timely manner. And I didn't have to do any bird beacon or plier adjustments to where it sat on the canine and or in between. And that was something like even with my lab or my Dr. Fit bands and me putting staples and making sure it's all in the right spot and having it poured up correctly, I would still have to make micro adjustments here and there, which was always really frustrating. So this just makes it kind of a plug and chug. It's like dropping that crown in when we used to do real crowns and there was no adjustments needed. That's kind of how I equate those appointments too. This is that traditional lower lingual, but with that the 3D SLS cuspal coverage. The middle image, you can see the intaglio is a little like kind of frostier. That's where that surface area is gained, and that's where it can sit, and it covers just that occlusal third of the cusp, which makes it nice and clean and easy for your patient on the cementation process. I have a few just kind of outside the box cases that I've used these things on. This was a kid came in for an emergency appointment, irreversible pulpitis on T, needed to get the tooth out. She was not going to sit for any kind of real treatment. We had a sedation day like in 2 days, not enough time to do a turnaround on the case, but we knew we needed to get the tooth out. She had a large swelling. We were able to get it done. We modified abandoned loop. I did not think this was going to last. I told the mom right up. I was like, we're going to leave this here as long as we can to get the sixes in a little more. Let 23 and 26 are up because we only had 24 and 25 in, and then we will switch her to a bilateral appliance. This appliance is still kicking. It is still cemented in there. She let me cement it even with that fat distal operculum on the backside. And this is one of those little girls that just looks at you and you know it's going to go bad. She's actually a really fun patient now. She likes to come in. We kind of got her through a lot of the fear stuff. But this is where I really put the cement and that intaglio surface area to the test. Having two, we know bilateral is going to be more stable. I thought this was going to come off the first time she ate a peanut, chewed on ice the wrong way, did something, just function because of that kind of cantilever that we put there. But it was a very successful case. Very happy patient because she didn't feel anything when I was doing the cementation because it didn't touch her gums. Another case just like that. This was another case. We had to get a tooth out. This kid had horrible hygiene, would not let me anywhere around the gums. We had scaled them every 3 months for a year. We ended up losing Jay early. And I knew cementing on him, I did try to kind of do a more traditional approach on him, would not let me do it. I said, hey, let's do this little kind of 3D kind of option. And this was one of my first cases with it to see if I could get it to work. The cementation went super smooth. Like for my patients with special needs, patients with autism and sensory aspect, not going under the gums when you're cementing these bands makes a world of difference on those appointments. Your compliance is better. You can tell show do through it, showing them the model, letting them play with it. I always let the kid take the model home afterwards. It's like a little trinket to put in the room because we have their models in the cloud. I don't keep plaster models in my office anymore if I was doing a phase one or any kind of ortho case because we have that available in the system and it's just hosted on their servers. And if you do have an office where you guys have been doing ortho for 20 years and you've got just stacks and stacks and cabinets full of plaster models from having to keep them over the years, you can have one of your assistants sit there and scan those models. And now you have those records, compliance wise that you need by our law standpoint in your system, and you can clear space and make more room for other things you need in an office because we always need more space. This was a kid who came to my office first day I ever met him. He had an abscess. Wanted to get the tooth out right away. Wanted to get him scanned because we needed a bilateral appliance on him. So we had him diagnosed. I was like, hey, we got like 30 minutes, Mom. We could probably do this because it was like a Friday. And I knew like getting him out of pain would make the weekend less stressful for the parent, less stressful for me waiting on a face to blow up. We were able to treatment plan, use a sew-in, get him numb really quickly where he didn't feel it, and get him scanned and got the tooth out all within probably an actual like 15 minutes of him being in this chair. I'll kind of fast forward through this. This is us kind of like just getting a little scan. You will see a little heme in the upper left corner as we're getting through it. And that's where I gave my injection. We were taking out number J. This kid was terrified coming in, just talking to him and walking him through it, and him kind of seeing how easy the tech was allowed us to do everything we needed to do. We got the appliance back in 2 weeks, got it cemented. Happy kid, still in my practice. The whole family ended up coming over to us just because they were impressed with everything we did that day. So this is a practice builder too. When parents see the workflow that you and your team can do, they're going to go talk to their friends. I always tell parents, I'd rather you tell every mom in your neighborhood on the mommy board page versus a Google 5-star review, because that word of mouth is what really builds your practice in the community. And I want parents to know, like, hey, we are utilizing the best, and it is a great marketing tool. Don't hesitate to utilize this on your social or websites, because it is really good at getting kids or your info out about your office. So you're not just a bread and butter dentist, you're one that goes above and beyond for your patient. And at the end of the day, it makes your life easier as a dentist. This is another case, just have those fat distal operculums. This is like my bread and butter for using that SLS coverage, just because I know it's going to be tough. We have some teeth that need to come out. We were able to utilize this and get it all taken care of. Now, this was an aspect when I bought the Allied Star. I didn't know this was even a piece of what you could do with it. This is an added piece of AI software. I'm going to click into this and see if I can make this happen without screwing everything up. Is it playing, Jordan?
Yeah, it is.
Okay,
Is it
cool.
playing for you?
If you guys can see the screen and it's clicking through, we're good. I just wanted to make sure it was doing the right thing. I will probably have to stop sharing and stop the YouTube afterwards. But this is a way, like, if you're doing any kind of bigger treatment plan presentation with restorative and or ortho included, you can input your scans, input photos that you've taken with it, and put this together really quickly. And then the AI will kind of take all of the info that you gave and put together a health report for your patient. So if you have a parent that, hey, I understand this, but I want dad to understand how severe this is, or to understand, like, this is where the work needs to be done, this is something you can utilize. As pediatric dentists, we're not going to do this a ton, but we do have certain scenarios where it's a bigger case than we're typically going to do. There's more steps to the case that you're going to work through. And this allows you to kind of really fancy it up for them. Within 5 minutes of you doing some actual work, it's going to spit out a 30-minute kind of presentation that you would traditionally do AI wise. And it gives you the ability to just have another tool in your toolbox. It's cool to play with. You can use it. You can not use it. We've used it a couple of times. More of my assistants just playing with it and like putting their own stuff in and kind of seeing where their mouth could go with the before and afters. You can attach x-rays to it, intraoral images, and it just lets you kind of flow through. And again, it's just a cool aspect of the product itself.
And one of the neat things about this as well is, like, it's a printable format where you're able to, like, export it and then actually print it, have the patient take it home. But it's fully, customizable and editable. So you can add notes, anything else you see going on, or edit whatever they're saying as well. But like Casey said, as a pediatric dentist, you may not use it like a ton, but it's just something, like, again, they're constantly adding new, like, innovative things on there as part of the software with updates and everything else. So this is one of the newest features in which they've added.
See the before and afters. This is really big on, if you're doing ortho, just for them to be able to see this is what we can look like. And then they get just a better idea of kind of what their intraoral aspects are. I'm going to see if I can do this without screwing anything up. I know I need to pause this.
Yeah, pause that one because we'll go to, like, next video. I remember that happening.
Boom. Look at this. I act like I don't want to do it. Took me how many seminars to do? All right. So getting past kind of like what it can do, how to get your team trained, like the biggest thing for me with every purchase that's big in the office is, will I get a return on investment? I want to make sure if I'm investing in something, it's going to be used in my office and not collect dust, and that I'm going to be able to pay it off in a timely manner and then make money on it. As a business owner, we have a lot of mouths to feed, and as a team side of things, I want to make sure we're continually making the money so I can have them paid, bonus them if needed, and make sure that they're happy campers. The quick off the top tangibles, no more trays, no more materials. You have a scanner. You don't need alginate impression material. You don't need stone. You don't need trays in the office. No remakes. Like, I have not had to remake an appliance other than the kid that has shown up 6 months past their cementation date, and there's obvious space loss that's going to occur there. You're going to save on the lab because you're only doing one-way ship. And I do like NeoLab because if you have like scans Monday, Tuesday, and Wednesday, like, you can be like, hey, let's just throw those all in this one and kind of get them all back in one group, and they can do a quick turnaround. The biggest ROI, just right off the bat, is the chair time. Like having more production available in the office, being able to put this in a open bay as opposed to a closed room for a tougher kid because it's going to be an easier impression visit, and having that closed room available for a recall or a treatment. And in our office, that was big. Before I expanded, I only had 2 closed rooms, and if I had a screaming 2-year-old and an op going on, I couldn't do an impression on a tough 8-year-old in the open bay because I didn't want to stimulate other kids in the area. That's been huge for us, and the ability to kind of turn things over and just be more productive scheduling wise. When you are doing through your kind of scheduling, you can start modifying your systems of how your front desk does this. Hey, instead of having to block 30 minutes for it, we can do 15. And for the deliveries, instead of a 30-minute delivery, it's going to take 15 minutes. We can kind of double stack those and just kind of roll through them. I already mentioned the 3D model inventory going digital, which was huge. I only had a few to scan because I didn't do a ton of phase 1, but they were lying around the office, so they're there now. The impression being faster and the delivery faster, it's big. Like for me, that was just the tangible, I pick it up and can use it ROI. Now down the road, like you're going to build confidence in doing these things, and you're going to realize like this scanner can get me impressions that it would have been harder, and we can start thinking outside the box with how we form our appliances, and then other treatments that you can do for your patients. The bigger things that you can do that are productive in the office are aligners. I've used a company called OrthoBrain in the past. I have an orthodontist now, so we're utilizing Angel aligners. He was actually in my office today. We're just getting everything going, and he's like, this scanner is awesome. He's like, I really like that it's wireless. He goes, it's very easy to use. He had his team practicing with it. They are ortho assistants, so at the end of the day, they're comfortable with these things, but even the assistant said, like, this is nice. Like, I do like this scanner. We should buy one of these for our main office. The procedural confidence is huge. Like when you know what you can do capability wise, you're going to be more confident. You're going to be able to relay those treatment plan options to the parent more. Those parents are going to have more confidence in you accepting those treatment plans. It just makes for a more cohesive experience. And then marketing. I kind of talked about this, but definitely if you're bringing new tech into your office and it's making the appointments easier for your patients, highlight that, talk about it on your socials, highlight it on your websites, and make sure people know, like, hey, if you come into us, you're going to have a smoother, easier process than you would at maybe another office. And then your referring dentist, when they kind of see like, hey, like I took care of this kid under station, they went back with mom to their home office, 45 minutes away. They can see like not only does the dentistry look good, but the appliances fit nice, the hygiene is good, and the turnaround was good on it. So it just kind of brings those referring dentists putting their patients, trust back into you at the same time. So the biggest thing everybody wants to know, how much does it cost? What's included? This is kind of your screenshot of these pricings that are there. I went with the 200E with the laptop. I didn't want to go purchase something and have to return it or have my IT guy have to load new software on. Having everything on the website or on the laptop, ready to roll, made it much easier. If you're a techie person and you're like, I got laptops laying around the house that can do this, buy it without it. You can make it happen. The tips themselves, you do get large tips by default. You can get the smaller tips. We have 2 and 2 in our office that we float. They're autoclavable. The best tip that Jordan gives and that we were using is just like if you have intraoral mirrors, don't throw those raw in your sterilizer. Put a little gauze over the kind of mirror tip, and it's going to make your tips last a long time. We really don't have a lot of breakdown on them. I haven't had to replace any, knock on wood, no kids have bit them off or anything like that. I did have a kid bite a sensor in half last week. That was a much more expensive mistake. But they're there for you, and the 3-year warranty does come with it. So if you have questions about pricing and stuff, this is where you get with Jordan and the team at New Smile, so you can talk through your options, and then got a little more info for you guys too. This was cool. They sent me this week. We added this because if you're not 100%, scan this QR code. You can schedule a demo. You can have them come out, do a demo at your office, let your team use it, let you use it. And as this doctor says, just want to give you a heads up, we received the demo scanner and laptop back. And the guy was like, thanks for all your help and patience. The team acclimated so quickly, they did not want it to go without one. So that is just a testimony of a doc. If you're on the fence, this is great. Like for me, I would have jumped on this all day and be like, yeah, bring that in. Let me play with it. Let me see how it works. And it's going to sell itself typically because you're going to be happy with it. You're going to see how quick it works and your team can play with it and they can give you personal feedback. I love getting feedback from my team. I always want them to bring things to me that we can improve because we're never perfect. We're always growing. And this is a great way to get their input and have them like feel like they're a part of these decisions, which is big for team buy-in.
Hey, Casey, I'm gonna clarify real quick. We don't have field reps in NewSmile. We can't come out there and do it. But what I'll do, I'll actually send you a scanner and a laptop for you to actually try out yourself.
That's what I thought. Yeah.
And I'll jump on a virtual call with you to walk you through how to set it up, how to use it, and then let you guys play with it, for a week or two. And that's all paid for by NewSmile. We'll no cost of that. It's a free demo for you guys to try out, and you'll jump on a virtual call with myself to kind of go through all of that, how to set it up and use it and everything.
Sweet. Yeah, that was what I was alluding to. Sorry if I was confusing on that. But yeah, that it gives you the ability to try it out, which is I think a big thing for a lot of docs. They want to touch it. And then if you want some hands-on experience with digital scanners and or the anesthesia systems that are available through NewSmile Tech, this is where to do it. There's hands-on workshops for both the intraosseous anesthesia techniques and the digital scanners. You got some of the best down on the bottom, Dr. Solomon, Dr. Ruck, Dr. Bond, who are amazing clinicians and educators. These guys know way more than me about stuff, and learning from them would be a great opportunity. So if you're on the fence about any of this or just want to get exposure to those things, definitely jump over to Houston in November and kind of get this on your radar. It's always fun courses with NewSmile, and you're going to learn a ton from these guys. They're very knowledgeable and know these products in and out. And then these are your reps for NewSmile. So if you guys do have anybody or any questions that you want to get with, this is who you can reach out to on the NewSmile side of things. Jordan is who had been our host today. Aaron is another account manager. And then Chris is the national sales manager. All super knowledgeable on the product. They've helped me with many things in my office and career. Feel free to reach out to them. And then I'll kind of keep this here if you guys want to get some info. One thing that we typically start talking about a little bit closer to the end of the year that I can kind of put a blurb while you guys are getting this on is talk to your CPA. If you are in hey, should I spend money this year? Is this a purchase I should make? Am I trying to increase my expenses to decrease my tax burden? Talk about the 179 credit with your CPA. This is one of those. It's a product you're going to use, and it's not going to sit in the corner. You're not buying a laser that you may or may not use because you have fantasies of doing certain procedures in your office with a $100,000 laser. This is one that could really be a justifiable expense that you're going to use daily. If your CPA isn't advising you on kind of looking at that yearly on ways to upgrade your office before the new year, I would get a new CPA, but just something to kind of keep on the radar for you guys. And then this is my direct email. If you guys have questions, email me. I usually will get back to my emails within a day or two. And if you have any questions about the scanner itself, how we utilize it, implementations, if you have a tough case or something you want to run by me, shoot me an email. I'm an open book. And then NeoLab, this is the laboratory that I utilize. If you do want to learn more about how to use them, how to integrate them into your office, they have a lot of info and they make great products. So I can attest to that. And I think that is it.
Awesome.
So, do a little
Casey,
stop.
I really appreciate that. And so everybody, this is the time. Q&A, please. You have myself, you have Isabella, and you have Dr. Casey Lynn on here to answer any and all questions you may have. So please, anything you think of, please throw it in the Q&A. You got us for next however long you need us. So please throw it in the Q&A function. Casey, I will have you talk a little bit about when doing. I know you talked about it with NeoLab and everything. Using certain appliances, like I know you got into like sports guards pretty recently, right? Or have you been doing that for a while?
Well, I've made sports guards just throughout my career, but not a lot regularly. Doing the first few I did through Neolab, like I'm offering them a lot more to my truly competitive athletes. Obviously, we want to protect teeth, but I want to protect brains. You know, concussion is decreased tremendously with a really good custom mouth guard. And my patients that are playing lacrosse, football, soccer, you know, anything that's going to be heavy contact, I'm going to be recommending a mouth guard for it. Ice hockey's big around us too. And at the end of the day, like I've had these made from different labs and different techniques, you know, 1 layer, 2 layer, 3 layer mouth guards, and doing just like the simple 2 layer mouth guards. The kids love it's customizable. You can do that kind of anywhere, but the fit is amazing. Like every kid has put it in, go, this does not hurt. It doesn't pinch back here. The fit is so much nicer when you're capturing the anatomy with this, as opposed to like an impression. You can get really good physical impressions. It's hard. Like doing like a perfect PVS impression and capturing that entire vestibule can be difficult in a mouth, and a lot of gagging can happen. A lot of pulls can happen. Something that they had kind of put on my radar that we are soon to be implementing is like a mouth guard day in your office, talking with like your local sports teams and being like, hey, you guys all come to my office at a specific time. We're going to have you come. We're going to scan everybody. We'll give you the opportunity. Like if you're super philanthropic, you'll do mouth guards for the whole team at no charge. If you want to cover the lab bill, instead of charging full price, be like, hey, everybody on the team is just going to get lab pricing on this. You can do whatever you want as a business owner, but not only does it make your existing patients happy because they can get like a new mouth guard every year as they grow, and you have the comfort level of knowing these are great products. It builds your reputation in the community. You're going to get parents in your office that have never been there before. And my big thing is like, if a parent walks in my office, they're going to want to come back. Like they can feel the difference. They can see the difference. Getting them in the door is always the hardest part. This is a really good way to do it. And I was like, that is marketing genius when I heard this. So we are soon to be implementing those. That is on our October, November to-do list in the marketing.
Yeah. I was just about to ask if you're going to do one of those sports cards days or like mouth guard days that I know Olivia was talking about, like quite a few offices with Neolab implement. So
yeah, I used to buy shock doctors for like the football teams in the area because like I grew up playing ball. I always knew like half the kids had a crappy mouth guard that didn't even fit them. So I'm like, all right, here's a boil and bite. You know, I'll at least have 400 boil and bite mouth guards, you know, from Shock Doctor and help you out. But this makes it just that extra touch, and it's custom, and it just makes a big difference.
Hey, so again, I'll give it a couple minutes. If you have any questions, please, seriously, now is the time to ask whatever you have. I don't think I've had a webinar we haven't had multiple questions, so this would be a first. So please, if you can think of a question, ask it. Please, if you have anything. Casey, other thing, using the scanner presentation tool for the parents, bombed out cases, stuff like that, OR days, anything you have say about that?
The other aspect that I didn't really even think about, because I have like little dinky eBay intraoral cameras that can take some okay pictures, but it's more like really localized. Like you're going to be on one tooth, really with those intraorals. This like getting a full arch and like popping it up on that screen and like kind of showing the kid, and then the parent seeing like the giant holes in this tooth and the stains in this tooth and like the malpositions here, they can visualize it. Like parents don't see or think like we do when we look in a mouth. We can kind of twist it around in our head and visualize it 3D and kind of see all aspects of how big like a decay is on like the distal buccal of a lower molar. But with this, you can kind of turn it, you can present. It's great for parent education. Also like teen education, like showing a kid like, hey, do you see all this tartar that we're about to clean off your teeth? Like, you know, that's there. It's a great education tool. I love talking with parents, educating them on what's going on. And that was like one of those other things I never even thought I would use this scanner for was, you know, treatment plan presentation or parent-patient education. But yeah, that's a good aspect. I always forget about that, but it's a day-to-day that we're doing that and kind of showing kids. And you can make it like, hey, every new patient in the office gets a scan. And then as you're kind of talking through, especially if you're talking early ortho or cross bites, you can show them in 3 dimensions. And when they can see it outside of the mouth and it's just teeth, they can understand it a lot more.
Yeah. Yeah. That was super well said. So we got a question. Dr. Patrick Micaroni, I hope I'm saying that right. I apologize if not. So he asked, so the space maintainers you do day in, day out, like abandoned loop, is mostly that coronal coverage option?
So I wouldn't say my band and loops, majority of I've done one of those cuspal coverage band and loops. Like I wouldn't trust that in every kid. I really didn't think it would work. I was just trying to hold it over. It's been a couple of years and it's still sitting, so I'm not poking the bear. But no, I traditionally do like a more traditional band and loop where I'm going to kind of cement it interproximally. I use the new Smile chair side kits a lot because they just are smooth a lot faster than De Novo was for me with the universal bands up and down. If I'm doing anything bilateral, I'd say 90% of the time I'm doing the 3D SLS cuspal coverage just because it's clean. Like my big thing with any ortho stuff is hygiene's going to be poor. We're dealing with, kids in their prime of 7 to 14 where oral and personal hygiene is at its minimum. And I know they're not going to put the effort in. You have some parents that'll put the effort in. You have some of those patients that will, but the majority of those kids are heavily inflamed and have gingivitis that you're battling, year round. So for me, I like having that kind of cleaner cementation, less food impaction underneath the bands itself. And really, knock on wood, don't get a lot of debonds unless they're pulling at it, with their fingers. That's when it'll come out on like a patient with special needs who just doesn't like the sensory of it.